Okay, what causes anemia? There are several different things that can cause anemia. If we're talking about iron deficiency, let's change colors again here. If we're talking about iron, one of the things that will cause iron deficiency is gluten. Does gluten cause anemia? Heck yes, it can cause lots of different types of anemia, but iron deficiency is the #1 nutritional deficit in people with gluten sensitivity. And it's not just people with celiac disease. So a lot of people believe that only celiacs have this iron deficit problem, and it's not true. Non-celiac gluten sensitivity can also manifest as iron deficient. As a matter of fact, for many people with gluten issues, they have a lifelong struggle with anemia, and it's the only symptom that they have. And so they go through their life with the anxiety, with the trouble sleeping, with the chronic pain, with the dizziness and the disorientation and the unending fatigue. And it's because they're eating gluten. And gluten, what gluten does in the stomach, draw you a pretty picture here. Your stomach is lined by a layer of cells, actually more than one kind of cell, but one of the main cells in the stomach is called a parietal cell. And it's the job of parietal cells to secrete acid, and it's the job of the acid to help absorb the iron. And so what happens with gluten sensitivity, many people have gastritis, and that gastritis damages those parietal cells, reducing that person's ability to produce adequate quantities of stomach acid, leading to acid reduction overall and the malabsorption of iron that can come with that acid reduction. So if we're talking about what causes anemia, iron deficiency can certainly cause that. What causes iron deficiency is the next question. And what causes iron deficiency can be gluten. What else can cause iron deficiency? Heavy menstruation. So any of you ladies that have had heavy bleeding during your menstrual cycle, this is a common cause of transient anemia where, you hit, go through the month and you hit your menstrual cycle, and, there's this premenstrual issue that happens first where there's some blood loss, okay? And then you have maybe some heavy blood loss that comes shortly after that, and that's 2 weeks of the month, right? And then the next 2 weeks, for 2 weeks, you're trying to recover. Your bone marrow is trying to produce more red blood cells for the ones that you lost during menstruation. And by the time you finally recover, 2 weeks to recover, guess what happens? Boom, your cycle's back. And if you're having heavy menstruation, it creates the cyclical transient anemia where for 2 weeks out of every month you're finding that you're anemic and you don't even really realize it. You just think it's a part of your menstruation. Well, one of the interesting things about a heavy cycle, like a heavy blood loss, is that we know gluten can cause hormonal abnormalities that can lead to heavy menstruation. So very important to understand that connection as well, because you can supplement iron in this situation, but if you're having heavy menstruation and it's because of abnormal hormones induced by gluten, or any other environmental chemical toxin, etc., then you're never going to correct the problem at its core, and you're going to need iron indefinitely. And the problem with too much iron, if you just take iron indefinitely and you don't know why you're anemic, is iron constipates. And so now you're constipated, and all that poop that's stuck in you, right, it's now backing you up, and all those toxins from your poop, if you've got a leaky gut, they just start leaking into your bloodstream and creating more and more problems. So we don't want that kind of scenario. So again, iron deficiency causes anemia that can lead to, or that can be caused by gluten sensitivity. It can be caused by heavy menstruation. It can also be caused by, let's take some of these arrows away and make some room. It can be caused by poor diet. A lot of people go on a vegetarian diet, and don't get me wrong, I'm not saying that vegetarian diet's not the right diet for some people. It certainly is, and for other people, it's not. And when I see iron deficiency is when a person who's genetically doesn't fit the vegetarian diet tries to go vegetarian, and then they're not getting enough iron in their diet. So lack of diet quality or poor dietary iron intake. Remember that many of your vegetables, like spinach is an example of a food that's rich in iron, but it's bound. The oxalate in the spinach binds the iron. It makes it harder to absorb. It makes it harder. It's not as bioavailable. So we're talking about iron. The best way to get it is definitely through animal. Now again, there are some people that do better on a vegetarian diet, but it's the ones that don't, genetically that don't, those individuals tend to develop iron deficiency when they try to go on a vegetarian diet. So again, it's not me like trying to criminalize vegetarians. It's not at all what I mean, because again, some people are matching for that diet, but not everybody who tries that diet match it. So what else can cause anemia? So we've got iron deficiency that can be caused by gluten. We've got iron loss that can be caused by heavy menstruation, iron loss that can be caused by poor diet. What else? We've got what's called occult blood loss. All right, where would something like this happen? Occult blood loss could be that, let's say that you take non-steroidal anti-inflammatory drug like ibuprofen or Motrin or naproxen or aspirin, and you take these medicines, right, for your pain, right, which is interesting because what did we just say a minute ago? We said one of the symptoms of anemia is pain, right? So people don't realize they're anemic, but they take the medicine to treat the pain without understanding why they're having the pain, right? In this case, the NSAID. NSAIDs destroy the lining of the GI tract, so they damage the gut. You know, baby aspirin. So this is what commonly doctors will recommend, the baby aspirin to thin the blood as prevention. But you should understand that doses of aspirin, a baby aspirin is typically 85 milligrams or so. So it only takes 7.5 milligrams to cause gastric bleeding, occult blood loss through the stomach lining. Okay, so that's less than a tenth, right? So a tenth of the dose of a baby aspirin is enough to create blood loss if you're doing it every day. And if you've got occult blood loss, what does that mean, occult blood loss? It means you are losing blood and you don't even know that you're losing the blood. That's why it's called occult blood loss. And it's happening internally, so we're pooping the blood out, but by the time the damage from your stomach comes out in your poop, the blood oxidizes and it's no longer red, so it turns brown. And so you can't even see that it's there. And now occult blood loss is a test that your doctor can run. They can do what's called a fecal occult test to look for the fecal occult blood, because this is sometimes another reason why somebody can develop an iron deficiency. So again, this could be caused by drugs, certain medicines. Non-steroidal anti-inflammatories are one class of medicine that can do it. Steroids can do it. And some people combine steroids and NSAIDs, and the effect is even worse. So the damage to the GI tract can be even greater and cause even greater loss. So these are, again, anything that creates blood loss on a consistent basis is something that increases your risk for iron deficiency anemia. Again, one of the most common types of anemia, not the only type of anemia, but one of the most common. So these are things that you need to be aware of. What else can cause anemia? So we've got deficiency of essential nutrients. Let's make some room for that, because that's a big section here. Essential nutrients. Predominantly, what are the nutrients? So we just mentioned iron, so we'll put that back up here. But also copper. Copper is necessary to form the hemoglobin protein inside your red blood cells. So copper deficiency can create anemia. B vitamins, particularly B12, folate, vitamin B6 are the major B vitamins that are very, very important for formation of hemoglobin and also for the stimulation of new red blood cells. I missed a mineral up here, and that is also zinc. You got to have adequate zinc to make hemoglobin. So a lot of times, so think about this, what I said a minute ago about gluten. Number 1 deficiency associated with gluten sensitivity is iron. The number 3 deficiency associated with gluten sensitivity is zinc. The number 2 deficiency associated with gluten is vitamin B12. So the top 3 gluten-induced nutritional deficiencies affect iron, zinc, and B12, of which all of these together can cause different kinds of anemias. So deficiency of essential nutrients, inability to produce hemoglobin. Iron is necessary to produce hemoglobin. Copper is necessary to produce hemoglobin. Zinc is necessary to produce hemoglobin. B6 is necessary to produce hemoglobin. So those nutrients are very important to make the protein that carries oxygen. Then we have an issue with the structure of red blood cells. So remember I showed you earlier, we kind of drew a picture on the board and we said that A red blood cell typically looks like a squashed or a squished sphere. It's double biconcaved, discoid shaped, so that it can fit oxygen and carbon dioxide. But sometimes the structure of the red blood cell itself is abnormal. If a normal red blood cell looks like this, sometimes what happens is the red blood cell won't mature. And so when it doesn't mature, let's do you one more here. Let's make this more sensical for you. So this is bone marrow. This is my rendition of a bone. Please don't make fun of my artistry. But that bone marrow is responsible for producing red blood cells. And when red blood cells are born, they're very large and they're immature. Okay, so this is what an immature red blood cell might look like. Well, when a blood cell matures, it gets smaller. And as it gets to the right size, which is, you know, this discoid shape here, right? Let's move that out of the way. Then it takes on a normal shape. So when we talk about structure of red blood cells, in part we're talking about, did the maturation process of the red blood cell get interrupted in some way? So in order for you to produce red blood cells from the bone marrow, this requires B12 and folate. It also requires B6. Okay, requires those nutrients. So if you're deficient in these nutrients, you could actually have a low red blood cell count. But in addition, as this red blood cell matures, for it to properly mature also requires these nutrients. So you need these nutrients not only for the production of your red blood cells, in essence they stimulate the bone marrow to help you make red blood cells, but for the maturation process of red blood cells to get to the point where they're the right size, the right shape, and they have the right concentration of hemoglobin within, you know, within the red blood cell itself. Remember, that's that protein that helps to attract and carry oxygen and carbon dioxide. So we get an issue with the structure of the red blood cell, and so that could be partially an issue with it not maturing properly. And sometimes when a red blood cell doesn't mature, it also takes on an abnormal shape. So it might, instead of looking like that biconcave, it might crenate and look more kind of like that. And so it doesn't work as well. Remember, in biochemistry, and really in all of life, structure dictates function. So if the structure of the red blood cell is abnormally shaped, it won't perform the function efficiently of carrying the actual oxygen very well. So there are different kinds of genetic anemias too. We won't go too deep into those, but things like thalassemia, which is a genetic trait where the red blood cells, basically they don't take on hemoglobin, their hemoglobin is a little bit affected. And then there's things like sickle cell anemia, which is another genetic trait where you get sickle-shaped red blood cells that are poor carriers of oxygen, and so this can create anemias as well. But again, these are more genetic. What we're going to focus more tonight on are the things you have control over, which is not the genetic anemias as much as the nutritionally caused anemias. So again, maturation is very, very important. You'll see here, down here, bone marrow's production of red blood cells. As I mentioned here, the bone marrow produces red blood cells, but under the direction of these B vitamins. So these B vitamins become very, very important. And a lot of times what we'll see is we'll see a person with low red blood cell counts. And let's talk about some of the lab here. Let me make some space. So what happens when you go to the doctor and they're ruling out anemia? They'll run a test called a CBC, and that stands for complete blood count. And a lot of times you'll get these tests here, like MCV, MCH, you'll get hemoglobin, and then you'll get red blood cell counts, right? And then there'll be sometimes there's a marker on that test called RDW, which is red distribution width. And this is really standard for a CBC, what would come on a CBC. So if you went to your doctor and said, hey, doc, I think I might be anemic, can you run a CBC? And this is what they oftentimes will do. Now, one of the things that will sometimes happen is your hemoglobin will be low, and that might mean that you have an iron deficiency, but it could also mean that you have a copper deficiency. It can also mean that you have a zinc or a B6 deficiency, because those nutrients are necessary in order to properly form hemoglobin. You need those nutrients. You also need vitamin C to produce hemoglobin as well. And so again, any of these deficiencies can contribute to a reduction in the quantity of hemoglobin. That's why it's important to measure it. Then you have this marker up here. It's called MCV. That's mean corpuscular volume. So this is, think of this as the quantity of the size. Remember I showed you down here, I said red blood cells when they're born, they're very large, and then as they mature, they get smaller. Okay, so MCV, a lot of times it'll be high or be elevated, and that's because the red blood cell itself is too big, it's too large. Okay, and so it's stuck in this immature situation because of a lack of B vitamins. This is a very common situation. So a lot of times if your mean corpuscular volume is elevated, it could mean that you have a B vitamin deficiency anemia. And then there's mean corpuscular hemoglobin, which again, these two kind of tie together and they mean something very similar. So MCH, oftentimes mean corpuscular hemoglobin will be low along with the hemoglobin, and so these two together can mean that these deficiencies are potentially contributing to that. And then of course you've got total red blood cell count, which will sometimes also be low, and if it's low, it could mean that your bone marrow is not being properly stimulated, and again, that's predominantly B12 and folate that help with that process. And then, and this is one of the reasons, this is just a side note here, but some people that go on chemotherapy drugs can destroy or damage the bone marrow, and that leads to low red blood cell counts. And so a lot of times with chemo, there'll be an anemia that comes with that chemo, and people will start, they'll start developing anemia as a result of that. That's why some of the medications that doctors give with chemo are drugs that stimulate more red blood cell and white blood cell production from the bone marrow directly. But that's just a side note. And then there's red distribution width. And what a lot of times will happen is red distribution width will be high. It'll be elevated when there's an iron deficiency anemia. So that's a possibility there. Now, a lot of doctors, this is all they'll run. And if you don't have any problems here, they'll tell you, no, you're not anemic, that's impossible. And that's actually incorrect. This is not all that you want to ask your doctor to run. You would also want your doctor to measure your iron, your total iron binding capacity, and your ferritin. If we're talking about just trying to rule in or out iron deficiency as a problem here. So, to properly look at whether or not there's an anemia, you need to look at all of these things together, because sometimes what happens is your hemoglobin status is normal, but your iron or your ferritin is extremely low. And this is especially true of people with gluten sensitivity. This is actually the thing that we see oftentimes is the biggest problem, is that ferritin is very, very bottomed out. It's ferritin ranges, anything really less than 20 in a menstruating female is probably too low. But a lot of times we'll see ferritin, 5, 6, 7, 8, somewhere really, really super low, which ferritin is your stored iron. It's how your liver stores iron, so that when your iron storage in your blood, when your blood iron is low, your liver will distribute iron through ferritin into the bloodstream to kind of catch you back up. But if your ferritin levels are super low, you have no reserve tank for iron, and so you're more prone to anemia. And this is a lot more common in females because of the menstruation cycle. Menstruating females, they have programmed blood loss every month, and some worse than others depending on the heaviness of the menstruation. But these are tests that you definitely, if you're trying to rule out anemia, you can't stop short at a CBC. You've got to add on these components here, the iron, the total iron binding capacity, the ferritin. You've also got to ask your doctor to look at your B12, your copper, and ceruloplasmin, which is another marker for copper. You got to have them and ask them to look at your zinc, your B6, and also your folate. Now, there are other things that we'll add to this list too, like vitamin C and vitamin E, because deficiencies in these two nutrients, not only, vitamin C deficiency can cause an anemia in multiple different ways. And one of the ways that it can cause anemia is that low vitamin C makes it hard to form hemoglobin. But another way is that the red blood cells themselves, again, drawing you another picture here, this membrane around the cell, sometimes it's too weak. It's not strong, and it's not, it doesn't have integrity in its structure. And so that membrane will rupture. It'll rupture too easily. And if that happens, the cell breaks too easy, we call that hemolytic. Hemo meaning blood, lytic meaning to lyse or cut. Hemolytic anemia means your red blood cells, membranes around them are very weak and they break open too easy. And this is oftentimes caused by low antioxidant function. Vitamin C, vitamin E deficiency can both cause hemolytic anemias. And this is something that doctors very, very rarely look at. They very rarely check for premature lysing of red blood cells. And so these are all things that you want to ask your doctor to check into if you suspect you have anemia. Again, going back to the, that prior slide where we talked about the symptoms. If you're struggling with these symptoms and there's no discernible reason why you should be, and you've kind of exhausted all medical reasons why these symptoms might exist, but now you've heard this information, you're thinking there may be a potential possibility you have anemia, ask your doctor to do good diligence in lab testing to try to help you determine whether that's going on. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.